Hello, everybody, and welcome to our webinar for today on lead screening and housing partnerships, leveraging resources to improve population health. This is brought to you by the National Center for Health and Public Housing. And today we also have presenting with us Dr. Kevin Lombardi, who is also a part of NCHPH, who will provide us with a brief introduction.
Hi, everyone. Dr. Kevin Lombardi. I'm the Manager of Health Research, Policy, and Advocacy at the National Center for Health and Public Housing. My background is as a medical doctor and epidemiologist. And thank you for your service to your community and for joining us today.
Thank you, Kevin. And this is just a kind reminder to everybody that all participants are muted upon entry. If you have any questions or any concerns or any promising practices that you would like to share with us today, please make sure that you include that in the chat. Raise your hand if you would like your line to be unmuted. This meeting is also being recorded, and the slides and recording link will be sent via email after today's sessions to all of you. So the mission of the National Center for Health and Public Housing is to strengthen the capacity of public housing primary care grantees and other health center grantees by providing training and a range of technical assistance. NCHPH is a project supported by the Health Resources and Services Administration that is also a national training and technical assistance partner. The information presented today are those of the author only. All right. And next, we're going to hear from Dr. Kevin Lombardi.
Hi, everyone. Thank you for your time today, and thank you for your service to our community. This document, this slideshow, has a variety of resources available as links on it. I'd encourage you at your own leisure to take a look at those if you're interested more in the material. Here we see some of the details on our FQHCs and our networks of patients that you all serve. Next slide, please. Our public housing demographics. Excuse me. These data describe the demographics of residents of public housing. As displayed, the 1.5 million residents demonstrate characteristics that differentiate them from the U.S. general population. For example, residents of public housing are approximately 2 times more likely to identify as African American, 1.5 times more likely to identify as Latinx, and 1.5 times more likely to be children. They also disproportionately come from houses that are female-headed. Residents, next slide, please. To briefly go over our session content objectives, we'll be reviewing lead screening and lead housing rehabilitation from an epidemiological and public health perspective. We'll perform an overview of the established frameworks and methodologies for lead screening and housing rehabilitation efforts, and present opportunities available to health centers, housing agencies, and public health organizations in funding and implementing lead screening and rehabilitation efforts. Next slide, please. This session is grounded in the social determinants of health. Health cannot be comprehensively understood or supported without an understanding of the whole individual. The SDOH provides us a framework for conceptualizing this. These diagrams display this visually. The perspective they impart will be integrated into the remainder of the session material. Next slide, please. The WHO conceptual framework describes the process of the SDOH and from what they stem from. The SDOH are a byproduct of our understanding of human rights, the policy choices we make, and our desire for more equitable outcomes in our communities. For those of you who are interested in a global view of the social determinants of health and its implication on your communities, the WH conceptual framework is a enjoyable read. It's a great companion with a cup of coffee in the morning. Next slide. Healthy Together, a toolkit for health center collaboration with HUD-assisted housing and community-based organizations, is a toolkit co-created by our organization, NNCC, and HUD that describes the various types of housing programs available at the state and federal level, as well as recommended frameworks for partnerships. For those of you coming from institutions that are looking to improve, strengthen, or create health housing partnerships, the toolkit is a great resource to help you do that and to provide frameworks to do that as well. Next slide, please. We'll begin with a case study that describes an individual that many of you may have seen in your community before. Mrs. Jones is a 39-year-old female, past medical history significant for type 2 diabetes and hypertension, who presents at her PCP clinic for her annual wellness examination. She's processed at intake by the facility LPN, vitals are taken, and an expanded SDOH screener is performed per facility protocol. Results are as follows. Heart rate 72, BP 150/86, and respirations 22 per minute. We have access to results from her previous exam 6 months ago, and they show heart rate of 68, blood pressure 130/78, and respirations of 18 per minute. The intake nurse indicates that Mrs. Jones appears mildly uncomfortable. Next slide, please. Results of the expanded SDOH screener indicate the following. Mrs. Jones lives at home with her husband and 3 children. They're HUD voucher recipients. They live in a single-family home that was built in the 1950s. There are no pending eviction or legal issues. She lacks regular and reliable transportation. Mrs. Jones is seen by her PCP, who performs a physical examination and adjusts her antihypertensive dose, refers her to social services. Next slide, please. In reviewing the referral, facility social services deems home visit appropriate due to Mrs. Jones's lack of reliable transportation and concerns for lead in the home. A community health worker is sent to Mrs. Jones' home to perform an assessment of their home and address her other SDOH concerns. The CHW comes to the following conclusions. The home was constructed prior to 1978. Both Mrs. Jones and her husband have been experiencing headaches, stomach pain, and constipation intermittently since they moved to the property in 2020. Mrs. Jones' children have not been screened for lead since they moved to this property. There are no other safety or accessibility concerns in the home. Next slide, please. The CHW networks Mrs. Jones to the following services. A community-based organization that provides transportation vouchers and ride sharing. In-network pediatric appointments for all 3 of her children. Scheduled follow-up in 30 days by the CHW. As with many of your organizations, Mrs. Jones' landlord is a member of a network managed by her local housing authority. The landlord is networked to the following services. A technician will be sent to the home to perform testing for lead throughout the home. Information regarding lead toxicity will be given to the landlord, and resources for lead rehabilitation. Next slide, please. Many of you come from institutions that have instituted a person-centered healthcare model. And many of you use SDOH screeners in your service to your patients. Many of our health centers use the Prepare screener, RX screener, or other screeners as well. For those of you who come from communities that have old housing stock, houses created prior to 1978, or have other housing concerns or other SDOH concerns in your community, it may be appropriate to expand your SDOH screener to capture this data. This is, of course, depending on your facility protocol and policies that are already in place, but the literature has established that facilities should adjust their SDOH screeners to meet specific needs within their communities. In particular, if you follow the link to this publication, you can get access to a number of case studies that examine this issue in particular. Screening tools should be adapted to meet the following. Capacity to address specific SDOH needs in your community, including lead toxicity and other housing concerns, availability of local resources and referral networks, ease of use within the clinical setting and clinical workflow, and ability of the tool to capture needs organization can realistically address. For those of you coming from communities that have old housing stock or may have houses that have lead paint still in place, it may be appropriate for you to add those questions to your SDOH screener. Next, I will pass out to Dr. David Margolis and Ms. Atoy Young. Thank you.
Great, thanks so much, Kevin. So my name is Dave Margolius. I'm the Director of Public Health for the City of Cleveland. And with me today is Atoy Shakila Young, who's a Program Manager for our lead Healthy Homes team at the Department of Public Health. I was going to spend a few minutes with you all kind of giving sort of the history of lead in the City of Cleveland and our interaction with the lead program, and then move on to kind of how we interact with families affected by lead and healthcare systems, if that's okay. So I, in 2015, was a primary care physician at our safety net system called Metro Health here in Cleveland. I just moved here from San Francisco and internal medicine, but still really had not learned a lot about lead poisoning in my work in San Francisco at all at that point. In that fall of 2015, a series of articles were written about the Cleveland Department of Public Health because one of the reporters for our local newspaper, her daughter was poisoned by lead. And she was trying to reach out to the Cleveland Department of Public Health to figure out, what her next steps were and this process. And she came to find out that at the time, the city of Cleveland had a backlog of over 3,000 cases of families affected by lead poisoning that had yet to be contacted or investigated. So this reporter kept on writing a series of articles that were really fascinating and heartbreaking and tragic. And as a result, the rest of the city, and I think other parts of the country, certainly HUD, took notice. Certainly the state of Ohio took notice. And as a result, a number of foundations came together, raised over $100 million. The city invested in terms of our own internal resources, more folks into the public health department. At that point, it had grown pretty bare bones. And fast forward 7 years, I applied for the job to be director of public health for the city of Cleveland last year. And our current backlog, and Atoy has been in the role since around the same time, actually, as interim and then permanent program manager. Our backlog of cases is consistently zero. We reach out to every single family affected by lead poisoning on behalf of the state and help them through the process of what it means to be affected by lead poisoning. So additional context in the city of Cleveland. At the time, back in 2015, 2016, blood tests for kindergartners in the city of Cleveland showed that one in four kindergartners in the city of Cleveland have been poisoned by lead. So this is a huge problem. And unlike other parts of the country where water was a source of lead poisoning, in Cleveland, just as Kevin said, it's all the housing. It's all this old housing stock built before 1978. That due to generations of underinvestment from the banks and from landlords and people who weren't able to keep up their homes have just crumbled and poisoned the dirt and poisoned the homes of places where kids live. So that's the big picture story in Cleveland. We have gotten our act together. We've got incredible people here at the Department of Public Health. And I'll just walk through what happens today when a child in Cleveland is poisoned by lead and what our next steps are. And then Atoy can fill in any gaps. So on behalf of the state of Ohio, the city of Cleveland Department of Public Health, anytime a child tests positive for lead poisoning, a level greater than 10 micrograms per deciliter, our team here gets an alert from the state of Ohio. It takes a couple weeks from the time you all do the tests and your clinics to the time we get the result. But we get that result, and then our team, our case management team, reaches out to those families, reaches out, because oftentimes, people aren't eager to pick up the phone from a strange number from, the health department or the city of Cleveland. Over the case of last year, our no contact rate was less than 10%. So they're really reaching out. Our goal is less than 25% from the state. Once we reach a family, we talk to them about possible exposures of lead, what that means for them, what are next steps. If we determine that the possible source of lead poisoning is from their homes, then we set up time to do an investigation in their home, where one of our health inspectors will go to their home and test areas all over the home and just outside the home for lead poisoning. At that point, if we identify the source of lead poisoning, we then refer the families and whoever owns the home, whether it's a family or a landlord, to a couple different resources so that they can apply for funding, so that they can potentially move out of their home temporarily, and then also do the necessary work to rehabilitate their home, to abate their home so that that source of lead poisoning is gone. Sometimes just by the phone investigation or the in-person investigation, we don't find the source of lead poisoning. And in those cases, it's possible that the family just moved from somewhere else, or it was a one-time thing that hopefully it won't happen again because we've gone to their home and you know, we found that it's safe. But most of the time we end up doing the investigation, we find a source of lead poisoning, and then we're hopeful that we can work with the families and whoever owns the home, whether it's a family or someone else, to get to the point that home can be lead safe. A lot of times that doesn't happen, and families have this really difficult decision, and our health inspectors have this really ethically complicated situation where they're working with families who have to choose between homelessness or living in a home that we know to have lead poisoning. If a home has not been addressed within 3 months, we put one of these things on, my visual aid here, which is a order to vacate the home, and says this property contains lead hazards and has been declared unsafe for human occupation. We've got those stickers on nearly 400 homes in Cleveland right now. Unfortunately, we know that some of those homes are still occupied because it's a sticker that people just take down, and landlords do disingenuous things. And you know, continue to rent out those homes. And so we work hard at that. It's a kind of a cat and mouse game, but ultimately our goal is to have more and more lead safe, affordable, safe and affordable housing in the city of Cleveland, so that you know, our department does not have to continue to react to lead poisoning, and we can be much more proactive in preventing lead poisoning in the first place. So I'm going to turn over to Atoy in case anything I missed there in that summary.
You pretty much covered all of it. The only other thing is what we're trying to do is look at some more proactive things. So we're working with Bright Beginnings. They put together a parent group where they're providing some educational information to the families as well. And what we're doing is we send out a letter to every single family, as well as our families that also are tested below 10. So those families as of right now are 5 micrograms per deciliter up to 10. And we also send educational information to them. So we send that, and then we also try to contact them, or they'll contact us back, and we'll try to at least give them some information as far as where we think it may be at, in order to try to get the child's levels down and not get it over that 10 mark. But for the ones that do reach that 10 mark, it's a very low percentage that is somewhere else other than in the home that they're actually in. And our inspectors, even when they're out doing the investigation, if they see some areas that look very concerning, they'll address those areas with the family at that moment in time to try to avoid having the child around those areas. They'll also take them through different steps on cleaning as well too, because those are things that keeps the levels down, and normally something that we're doing in the meantime of trying to get the family to the resources. So constantly talking about cleaning, healthy eating, and we take all this information out there to them as well. And something else we've decided to add to our packets, when we're sending out that information to the owners of the property, we are sending out information for resources as well too. So we're including that in our packet that says, here's your order, here are the things we found, and we're sending that out to them as well. Sometimes we'll get their information by email as well too, and we're starting to connect with them a little bit more that way in regards to sending out that information to families by email. We definitely try to let them know that we're available in order to have them call back at any point in time to our caseworkers or to the inspectors that's been out to the property, and our compliance department as well too. So that unit works an amazing job of working with the contractors and also getting back in touch with the families in order to try to connect them with what their next steps are, what they need to be doing. Sometimes it's helpful when we see the levels are constantly going back and forth. We're going out there and saying, we need you to start doing these things in order to maintain it, but we try to encourage them not to do the work themselves because they need a lead abatement contractor to do the work. They needs to be licensed with the state of Ohio. So just continuously working with all our community partners, medical providers on a daily, weekly basis in order to provide the resources for the families.
And one thing that's been great just for the healthcare folks on the call, Metro Health, our safety net system has reached out to us, and we have a weekly huddle with them, which has just been great, just so they know, on our end what's happening, and we know on their end what's happening. Because it's easy when you don't have these lines of communication to be like, oh, the city is doing X, or oh, their doctor is doing Y. And so just to keep those lines of communication open and know, how hard all of us are working in our own spaces and collaborating.
And just the time off of what Dr. Margolis is saying as well too, with Metro, it's to the point where we're definitely on like first name basis, not just the nurses, the pediatricians contact us as well. It can be something last minute or a family is in the room with them, and we definitely do try to say, hey, while you have them there, have them call us so we can try to get this questionnaire completed. But like he said, we are continuously contacting these families to try to move them to the next stage of getting the property inspected and what we can do to provide them with resources.
All right, so unless you want me to pause, we're going to do questions at the end. So I'll turn it over to Bruce and Brenda.
Well, thank you, David. I appreciate that very much. My name is Bruce Haber, and I am the Director of the Program and Regulatory Support Division and within the Office of Lead Hazard Control and Healthy Homes. In all, let's say, openness and stuff, I should let you know that prior to joining HUD about 17 years ago now, I'm originally from Cleveland. I worked with the Cuyahoga Metropolitan Housing Authority, and I ran their environmental programs and worked very, very closely with the city of Cleveland. So David, I'm extremely pleased with what Cleveland has done since I left, and congratulations on all the really great things that are going on now. So hopefully you can see my screen. And now we're sharing with you. And I want to welcome you all to National Healthy Homes Month, but also recognize one of my coworkers who's going to be speaking with us today too. And this is Dr. Brenda Reyes.
Thank you, Bruce. And thank you, David and Beto. Beautiful presentation. It's really a pleasure to see what you guys are doing in your area and how you're using the community health workers. I am the director for the Policy and Standard Division within our office in HUD. And I'm a medical doctor, as well as I have an NCHPH with a focus on environmental. And with that, let me pass to Bruce to start our presentation.
Okay. I want to thank you there. And then Brenda, or everybody on this thing. I want to talk a little bit today about HUD's efforts for the last 32 years. HUD, the Office of Lead Hazard Control and Healthy Homes, came into existence in 1991 as part of the efforts to eliminate lead hazards in housing. And we have shown over the years that putting all this money out to control lead-based paint hazards has a definite return on investment. There's been studies that have been published that show that for every dollar put in to prevent lead exposure results in a net savings of at least $17, which since 1993, when the program began, our lead hazard control grants has resulted in an estimated savings of $187 billion. So there's a great effect, and all these funding that we're going to be talking to you about shortly goes out into the communities and the communities use them to address lead-based paint hazards, but also other hazards. And so it's not just lead-based paint that this office funds, repairs or improvements to housing and other stuff like that. But lead-based paint is a big issue. There's also problems with improper ventilation or indoor air quality, asthma and allergy triggers within our homes, sometimes particularly in low-income housing or in immigrant neighborhoods. There's a lot of overcrowding, and this can all lead to home safety issues such as slips, trips, and other problems in there. And with that, we have kind of an example here where we talk about a single event.
Absolutely.
In this case, a
Yeah.
water leak.
You know, this is probably one of the best slides to define or to show what we're talking about, how an event, one simple event like a water leak, can actually trigger to housing problems. We know how it will damage the structure and, you know, how actually will release some of the hazards. These hazards have a health effect on the individuals that live within the house, such as, you know, if we're talking about asthma, allergies, and how we never, or we are not thinking that the house may continue being the source, you know, the hazards within the house that are causing all the health effect in our patients or in the individuals that live within the house. That is the importance of what you were describing earlier about the community health workers doing the visit to the families, to the individuals to see what happened. With that said, you know, it does not have only the effect on the individual, but also it has effect on the cost, what it are the hazards, you know, how it's affecting the families that are living. And this has also a cost to society because it's not them isolated, but then if you see the multiple aspects that are going to be touched by such a simple event as the water leak, how it affects, it becomes a housing problem, how it's a hazard for the individual, how it creates a health effect, the cost, the impact on the cost for the individual and the cost to society.
Thank you, Brenda. And we love this little slide because it does give a perfect overview of just one little problem with a home results in so many impacts to the individual. It has health effects, it has a cost to society, and can greatly, you know, impact somebody for a lifetime. So our funding is designed to address a lot of these issues. And so we have a series of grants that are out there that we put funding out in the community. We're going to talk about them individually. We'll first start with kind of what they are. Our biggest program is the Lead Hazard Reduction Program. And then we have a couple of new programs this year, including the Lead Risk Assessment Demonstration Program, which is targeted specifically toward public housing authorities that administer the Housing Choice Voucher Program. And then we have the Lead Hazard Reduction Capacity Building Grant Program, which is focused on new grantees, people or communities that have never had a lead hazard control grant, and they don't have the infrastructure to do the work that's necessary. So our grants come out throughout the year. Right now, we have 2 grants that are actually closing today. The Lead Hazard Reduction and the Lead Capacity Building. So 2 of these grants closed today. The Lead Risk Assessment Demonstration application period closed last week. But we put out funding throughout the year. So even though it's closing now, just be aware of it. Work with your community to try to be ready for the next time that we post an opportunity. So we have some additional funding that's available. A lot of this is through Brenda's shop, including the Lead and Healthy Homes Technical Studies, a Healthy Homes and Weatherization Cooperation Demonstration. This is trying to get 2 grants from different agencies to work together. We have Radon Testing and Mitigation, which is another program designed specifically for public housing. And then finally, one of our newest grants is the Older Adult Home Modification Program, which, again, we'll talk more about it in just a few moments, but it's designed for older adults who are homeowners to do improvements to their homes so they can continue to live there as they age. So this is our largest grant program, the Lead Hazard Reduction Grant Program. And these have grants totaling between $1 million and $8 million to each grantee. City of Cleveland has been one of our longest term recipients of funding over the years. And so they've been able to do that, to do an awful lot of improvements to housing. Cuyahoga County is also a grantee of ours. With the lead hazard control grant, the focus is on lead-based paint hazards. So fixing those, eliminating them, things like getting rid of the old drafty wooden windows that are peeling paint, doors, friction impact surfaces and stuff like that. But the work is restricted to lead only. But oftentimes our homes have other hazards in them. And so we have the Healthy Homes Supplement. The Healthy Homes Supplement allows the grantee to address other hazards in the home at the same time that they're there to address lead-based paint hazards. So applicants include units of local governments, so state governments, Native American tribal governments, city or townships and county governments are eligible. The only restriction for a government agency is a state that does not administer the lead abatement program. This is an EPA program for licensing, certification, to conduct inspections, risk assessments, abatement and other stuff. If the EPA runs the state, then the state itself is not eligible, but every state, and I think there's only like 11 states that do not run their own program. So every other state is eligible to get these grants.
Bruce, I would like to add something on this that is very important. Even though if you read there and you say, oh, I am not, eligible to apply, there is a very important twist on this. You could partner with any of these organizations. And one of the issues that we have encountered a lot of the time, our grantees do not have enough units to work on. So the referral you were describing in Cleveland, that you actually sent a community health worker and you identified what hazards are there. This could be either you partner with them, being part of the application and receiving certain funding of it, or that these grantees that we have all over the nation could be your partners. This is a hazard that you identify, you can direct it to them for them to offer, the reduction of whatever hazard is identified in the house.
Thank you. Yes, getting units made available to the grantee to do the work,
Yes.
very, very useful. So it does help. Now, the funding for the lead hazard reduction grants are kind of broken into 3 different categories. And one of the most important ones for everybody that might be listening here is the first time applicant, somebody that's never had a grant before. So you start off at a lower amount, you can build up your program. And it includes, minimum of $1 million up to $4 million. But then you're not competing with those grantees, such as the city of Cleveland, who have been doing this for a while, know how to write an application and run a decent program. And so there's other smaller communities that might be able to apply on a first time basis because we set some money aside specifically for them. We also have, and this is new this year, we haven't had this type of a capacity building grant. There's a lot of communities that are very small and they do not have lead abatement contractors. They do not have renovation contractors certified under the EPA renovation, repair and painting field. They don't have inspectors. They don't have risk assessors. They don't have the community connection to implement one of our lead hazard control grantees because there's an awful lot of work that goes into running it. So we have capacity building. So this is designed to help build the infrastructure necessary to have a good and successful lead hazard reduction grant program. So it enables you to hire qualified staff, to identify and work together in your partnerships and subgrantees, working with the local health department, the building department, community-based groups. There's funding here for you to be able to do that. So this grant right now is actually closing tonight at midnight, but we will be offering it again. So you want to pay attention either to our web pages or to sign up at grants.gov to receive notice of any HUD funding that might be available. This opportunity is available to states, federally recognized Native American tribes, and units of local government. So not available to the hospital, it's not available to the housing authority, but it is available to the units of local government. And we start off at a minimum of 500,000, go up to 2.5 million. It allows you to build the capacity. The next grant we have is designed specifically for public housing authorities that administer the Housing Choice Voucher Unit. Currently, in the Housing Choice Voucher Program, which is covered under the Lead Safe Housing Rules Subpart M, any unit that was built before 1978 and has a child under the age of 6 is required to have a visual assessment to look for deteriorated paint. Well, this program will allow the housing authority to conduct a lead-based paint risk assessment, actual testing of the deteriorated paint, the dust and bare soil to determine if there is a lead hazard in the unit. So instead of just doing a visual, you can actually test to find out what is there. So the LRAD, as we call it, provides the funding to the housing authority to cover the cost of the risk assessment or a lead hazard screen. So we have about $50 million available for housing authorities, and we're going to be putting this notification of funding opportunity, or NOFO, out on the street within the next month. And this is designed, again, specifically for housing authorities, and it will allow them to conduct the evaluation of a risk assessment in assisted housing under the Housing Choice Voucher Program. We also have some studies, some programs that Brenda administers, and I'll turn this conversation over to her.
You know, that it will be the lead and healthy home technical studies. That's one of the grants that we offer, and it comes out in one NOFO, but it has the two pieces. The lead technical studies. You know, these are research grants, this piece. And this is, again, another excellent partner, because most of the time we are looking for PhDs to oversee in our institutions that are focused in doing research, or that part of what they do is research, even though if they are not focused. These will be a very good, excellent partners for what what you guys are doing, basically, because in order to do this research, we then need the families to participate. And, the lead technical studies advance the recognition and control of priorities of the residential lead hazards. This grant, as it was described a little early by Bruce, is focusing on lead. The study had to be related with lead exclusively. However, the healthy home technical studies, any other hazard within the house, will be part of the healthy homes technical studies. And this one, the advantage of these grants is that the results of this research, we ask the grantees to do a publication, and based on these publications, we are trying to change or impact policy. Go ahead. The amount that the lead and healthy home technical studies, we receive a total amount per year of $7 million. And for the lead technical studies, we have a breakdown of $2 million. And then for the healthy homes, we have received $5 million, for the grantees. Who is eligible? We have the government agencies, including Native American school districts and institutions of higher education, public and Indian housing authorities, Native American travel organizations, non-for-profit and for-profit organization, and small business. This could be if your organization does not fit or fall within the list. You are excellent partners to collaborate with any of these organizations to do the research, do a referral, or even receive the result of the research at any time. We have other. Go ahead. We actually changed that one.
Yeah.
But this is the amount of the funding opportunities that you will see within our division. The lead and healthy home technical studies comes with $7 million that is distributed within the two grants. The healthy home and weatherization cooperation demonstration receive a $5 million per year for 3 years. But again, is applied, distributed with the applicants. For this one, I'll describe this a little bit later. And go back, because the radon, we had not mentioned the radon testing and mitigation that is for public housing, and it received a $5 million. We will enter in details now. Where, the Healthy Home and Weatherization Corporation, this is a coordinated delivery of services both organizations, HUD, Healthy Homes, and the Department of Energy, with their program that is weatherization, WAP assistant programs, you know, we enter into houses and we do the same thing, very similar things. And the families, you know, that we are reaching have the same income eligibility. So this is an effort from government to actually make these two institutions and these two grants collaborate to demonstrate efficiency, cost effectiveness, and reduction on type of grievance to the family that are actually receiving the support. Eligible applicants for this year, you know, this one, it is only the Healthy Home Production grantees for our Office of Lead Hazard Control and Healthy Home, and for the programs that are the Weatherization Assistant Program for the Department of Energy. Each grantee will receive $1 million. We expect to have 5 grantees. Again, for this effort, we are trying to identify the impact on asthma. And for them to be able to do the work, they need referral of patients that actually have asthma. What is the advantage? These grantees will enter into the home and reduce, you know, identify the hazards and reduce the hazards that are impacting the asthma on the client.
And at the same time, upgrading energy efficiency.
Oh, absolutely, absolutely. This is the last, it's a new NOFO for us. We're going to the 3rd year now. We have published twice the radon testing and mitigation for public housing. On this one, to be eligible, you have to be a public housing authority. And as the name says it, you know, this is to provide fundings to the public authorities, to the public housing, to be able to do the testing for radon, and it has funding to do the mitigation on them. They can actually, you know, apply between $150,000 to $600,000 per application. You know, whoever applied, they decide how much they will need to do their work.
It's a great opportunity for housing authorities to get radon tested and then get it addressed through a mitigation system if the levels of radon are above the EPA standard of 4 picocuries per.
Picocuries, yes. And with this one gives out the opportunity, if they did not receive enough funding to do the mitigation completely, they can reapply next time,
Right.
You know, for the amount of money that they are needing to complete the work.
And then finally, we have our last funding piece available, and this is the older adult home modification program. This is a newer program that our office has started, and it applies to where the grants where the work can occur is owner-occupied senior low-income homeowners. And the idea is that local government, I guess including public housing and nonprofits, if you can go in and do work in owner-occupied homes, so it's not assisted homes, but owner-occupied, and it allows the implementation of basic repairs or modifications where the older adults that are living there can continue to operate or stay in the home. So one of the things that we kind of see is a conversion of a bathtub to shower, to a walk-in. Grab bars, safety handrails, and other stuff under a big type of project. You might actually modify door sizes so that wheelchairs or other stuff could go through. But these, again, these are, you know, looking at, they have to do an assessment for the needs. I think it's a physical, not a physical,
Occupational
an
therapist.
occupational therapist, thank you, that would have to come by and take a look at and work with the family to determine what exactly is needed. And then this funding permits the repairs to the house so that the older adults can continue to stay there. This is available to nonprofits, local governments, a wide range of people or groups can apply for this, and it can have a big effect. And I think that's the end of what we have for kind of the announcement of funding, and we'd be willing to take questions at any time. Is there basic contact information? Dr. Brenda Reyes, Bruce Haber, and we're all both at HUD.gov.
Thank you so much to all of our speakers. We're going to begin our questions section, and I will start with my own questions, and I'll ask all of our participants If you do have a question, please push the raise hand item on the screen, or put things directly into the chat, and we will address your question and give you the opportunity to speak. I wanted to start with Itoy and ask you some questions about your system, and in particular, first with your CHW staff. You mentioned a couple times, and David mentioned that the role of community health workers in your system. I was wondering if you could give us some more details on how they function and how they do their home visits and so forth.
So our community health workers, we actually have them as pretty much like caseworkers as well too, which I know they pretty much do the same similar work. So for us, they are the initial contact to the families. So once I get those cases in, I assign them to our workers, and then they contact the family normally by telephone, or they'll send out that first parent letter as well too. Since COVID, our inspectors have actually been handling more of the going out in the field. So when we reach that point where we still have not made any contact with the family, our inspectors then kind of kick in and help with that portion of going out, meeting with the family, providing them with the information and completing that questionnaire so that we can schedule the inspection with them at that time. But they also provide the resources. They speak with the families in regards to potentially, if it's a home that we say we get out there and it's to the point where we feel like it's not safe for the child to be in, then our workers will also work with the families to see where they're able to transition to, connect them with some different agencies as well too. So they'll do that big portion of referrals and connecting and making sure that we send that information over to our partners, our medical providers, and things of that nature.
You know, when you were describing your system, something I found interesting is sort of the concept of trust in the community. And often folks, when they get a contact from a public health department, it makes their blood pressure go up. You know, it's kind of scary. And you mentioned your ability to really get to people and to communicate with them well and have good response rates. And I mean, I think that's incredible. It's a difficult thing to do. And I was wondering, like, how do you do it? Is it just an issue of just being persistent with communication, or is there a certain strategy that you use with families to build that trust?
So one of the things we did figure out is in the past, it was the time frame. So from the moment that they've been to the doctor, and as soon as we get that notification from the state, we're contacting that family normally that first day. So when that first 24 hours, either a letter has gone out or a phone call has been made in order to reach those families. So it's mainly the sooner we contact them so that it's fresh, that's what we're calling them for. And that has helped tremendously with getting in contact with the families sooner, and also working with the medical providers. So keeping in contact with them, letting them know Cleveland Health Department will be the one contacting you. We also work with the county as well too, because sometimes some of our clients cross, and so then we're referring them back over to the county and then providing them information, or even a home that we've been in contact with them and then letting them know that someone from the county may be contacting them because the home wasn't in Cleveland that the child is actually in, is in the Cuyahoga County boundaries.
You know, it's something I found interesting is the description of sort of the issues with the property owners. And I think a cat and mouse game is how it was described. I was wondering if you could go into detail about what sort of practice and policies work for community being able to get the message across to the landlords and give them the information they need and making sure they're compliant.
So with some of the owners, it's a situation where they're just not going to make the repairs, and we may need to refer those cases over to our law department and pursue it legally. And we've even worked with our law department as well to try to reconstruct our process for law review to see if it's an owner occupant, if it is a property that's rented, to see exactly what direction we want to go with how we decide to do enforcement. But for the ones that we probably have been in contact with, so when we're doing that inspection, we're talking to the families to see who is our contact person, if it's a out-of-town owner and a in-town landlord, if it's a big organization that just runs multiple properties. So we do try to make sure we have that contact. It's actually something that we have to include into our reports, so they're aware that we're out there, and within 3 days of even going out there, they get that notice. So we know exactly where we're sending it to. We've also reviewed our processes as well too, to make sure when it is a company that we're also notifying the statutory agents as well too, which was something that wasn't a pattern of practice prior, but we're definitely doing it now to ensure that all avenues of contact are being made. We have, with our current push, to also apply affidavits to properties. And so that's normally just a disclosure to notify buyers. And also our hope is also that families are also making use of it as well too, to see these homes that actually has a lead hazard control order present at the property. A lot of them are looking at it as, I gotta hurry up and either sell before they put this on there, or we need to do this work as soon as possible, or find someone who's gonna be able to do the work. And it's not just being able to just transfer these properties back and forth. So that's been a great initiative for us. And while we're doing that, we're also placarding citywide at the exact same time. So every 6 months we're doing this, and we're letting them know that this is something we're gonna continue to do until they bring these properties into compliance.
As you're describing this, what I'm seeing is like very firm communication of accountability and responsibility there. It seems the landlords are responding to that. And it's something that you mentioned that I thought was interesting is really knowing the details of what the landlords, what kind of landlord this is. It's not something that I've thought about. But as I think about it, dealing with a small landlord that owns 1 or 2 properties, or dealing with a large consortium that owns hundreds, it's probably very, very different.
It is. And one of the things that we have experienced is that, we do have our lead hazard control program in order to assist with the grant for that funding. But then we also have our rental registration as well too in the city of Cleveland, where the landlords have to do interim controls, but they can't get that certification without dealing with our lead hazard control order, because they can't go in and just do interim controls when there's an order on the property. So that was one of the issues that we were kind of seeing with the properties transferring and not notifying the buyer. And then they would get it and try to go do what they were supposed to do with getting their registration completed, and find out they got an order on the property and that they couldn't complete it.
Interesting. So the landlords would often sell the property quickly just to avoid having to deal with the issue.
Correct. And so with the bigger ones, it can go either way. A lot of times they'll have a property management company that's very attentive. They'll even stop down to speak with our compliance inspector to go over the method of control that they need to submit to our department in regards to the work that needs to be done. But then, like I say, it can, and even like the ones, some of them just don't know that they have resources. And so that's why our push to try to get more and more information, even when they're going out placarding, they take information with them in regards to how to come into compliance. So it has a list of information on there as well too, our contact information to call us back. So we're trying to get more information out there so that people are understanding that we have resources in order to try to bring these properties into compliance.
Thank you so much for those details, and thank you for your service to your community.
Thank you.
If I may transition quickly to our other speakers, I wanted to ask some questions about some of the grant process, and our attendees have some time to prepare for the upcoming year. With an understanding that grants are complicated, and creating them, are complicated. do you have any tips for our health centers and housing authorities in sort of what you look for in a grant, a pearl or a promising practice that you could recommend?
Okay, I guess I'll start. And each grant program can be a little different. And the first thing I would start with is make sure that you're signed up at grants.gov. And when you're at grants.gov, there's all the funding opportunities that the federal government puts out there. And you can set up a search mechanism to, pick agencies or pick particular topics that you're interested in. And then you will receive a notification that the notice of funding opportunity has come out. And then from that point, what you need to do is read the NOFO itself, or notice of funding opportunity, because it describes exactly what documents have to be submitted, what type of applicant criteria there is. Like, is this only eligible for cities? Is it eligible for nonprofits or other people like that? And then read through on the rating factors. The rating factors are what is scored in the application, and then start to build your team. Because even though a lot of times it's health departments that apply for our lead hazard control grants, they need the community. So whether it be church groups, community development, the local housing authority, to kind of be as a partner to help find those units that are eligible to have the work done in. So that's the best thing. And
yeah, I have a tip that has been very useful for us, and for the grants that we actually, published. We have a site, and we can actually provide it. I think it's the where we have all the previous NOFOs, the previous applications, like the ones even archive, you can go up to 1999, I think is the first one. These NOFOs, the notice of funding opportunities, are very similar. They change from year to year. Something is added, something is reduced, but in order to have an idea what other cities are applying for, you can go, 2 or 3 years back to see who received the awards. What were they asking for? How they wrote the grant? How they did their budget? And this is, again, as I said, it is not exactly the same, because you have to adapt it to your area, because you have to read the actual NOFO, the new one, to see what are the difference. But it gives you a sense. It gives you some guidance of, oh, they apply for this and they apply for this amount. They're doing this, they're doing that. It is kind of a guidance that you could utilize. But most important is read the actual that year that you're writing it, NOFO opportunity, because they are not pictured exactly mirror one from the other one.
another thought for somebody who's never applied for a grant before, but you're interested in a specific one, and we've had announcements of awards in the past, reach out and talk to that grantee.
Yes.
See what they did that was successful. Maybe they'll share some secrets. But that's a very good way to do that. And then you're talking to somebody who has the same kind of background that you do.
Yes.
Now, if I could ask a follow-up, a different question. You mentioned that you have specific opportunities in some of the grants for smaller organizations. Now, in my conversations with some of those smaller organizations, sometimes they can be fearful of investing the time into a grant because with fear that smaller organizations could be overlooked. But it seems like there are specific opportunities where smaller organizations should be encouraged to apply.
Absolutely. And I know that oftentimes, whether it be a community or a nonprofit and stuff, they may feel that they don't have the capacity to continue, they can't hire somebody. But our grants typically will pay for the project manager, so a percentage of their wages. And then if these, if you get an award, it's a 3-year period of performance, 2 years from now, you apply for another one, you can actually keep these programs funded and not have to worry about, stopping and starting. Because I know that's a lot of times a problem or a concern with applicants. It's like, how do they staff it? Well, we'll pay for the staff in a lot of cases.
In that, yes, we do. It's part of the grant. You will hire we pay for the personnel that will be writing the grants. But what I wanted to say on this is, if you are very successful, you can reapply and you can get it again. And you know, your success from running the first one allows you to apply. It's competitive. There is not a security. Yes, you know, you will get the money. And if you're a small organization, partner with another strong organization. Partner, you know, look what are the requirements and reach to them if you consider that you're not prepared to do it. Plus, our grants actually have also some piece where there is a 10% amount that can you receive upfront in order for you to establish the location where you're going to do it, to hire the personnel before, of course, you have to receive the grant. Okay, you receive the award, and there is an amount of money that we are allowed to give you upfront because we are reimbursement grants. But in these cases, we can give you that money upfront after you receive the award, to ensure that you're setting up your offices, that you're doing the hiring, that you are preparing yourself to run our grant.
Excellent. Well, thank you so much for that additional information. We are right at time. I'd like to thank all of our speakers for your time and your service today, and to your service to your communities, and to our attendees as well. Thank you for your time and to your service to your communities. Thank you very much. And I'll pass it to Peter.
Thank you, everybody. And thank you to all the speakers as well for such a great presentation and all the information that was provided. This is just a reminder to everybody to please complete our post-evaluation survey, which will be showed up on your screen right after you log out. And this is our contact information. If you have any follow-up questions or any comments, you can contact Dr. Kevin Lombardi at kevin.lombardi@namgt.com or me at fide@namgt.com. We will also be sharing the contact information for our speakers for today and the follow-up email. And thank you, everyone. Have a nice day.